The Royal College of Ophthalmologists National Ophthalmology Database monitors and reports on the number of patients that suffer from vision loss after cataract surgery. We do this to inform patients of the risks of cataract surgery and to help hospitals and surgeons reflect on how they are doing at delivering safe surgery to their patients compared to colleagues around the country. This video will explain what we mean by vision loss after cataract surgery. The eye is like a camera in that it has a lens in the front which focuses light. That lens goes cloudy as the decades go by and the vision deteriorates, but we can usually improve the vision for patients by removing of that cloudy lens and replacing it with a new, clear, synthetic lens. Of course, cataract's not the only reason why vision deteriorates as we get older, and many people will have other eye problems, for instance with the retina, the film of the camera at the back of the eye. As the retina ages, it often develops wrinkles or spots in a process called macular degeneration, which can also limit the vision, no matter how well the cataract surgery is performed. You will have had your vision tested using a chart with black letters on a white background, like one of these, which is a useful way to give an objective measure of how clearly you can see before having the cataract surgery. In order to drive a car legally in the United Kingdom, you need to be able to read at a certain level on this chart, and some patients choose to have cataract surgery when they are still able to read at that level. But the average patient having cataract surgery in our NHS will have waited until their vision is slightly worse than that before they come for surgery. But wherever your vision starts off before the cataract operation, you will be expecting your vision to be better afterwards. By reporting on the number of people who suffer vision loss after cataract surgery, we are looking for those who are definitely seeing worse after cataract surgery, reading at least 2 lines worse on the chart compared to before. The reason we don't call it vision loss if you're only 1 line worse is that if you test your own vision on the same chart every day for a week, the letters you could read may vary from day to day, even up to 1 line better or worse. But if your vision has dropped to 2 lines worse, then we conclude that this vision is definitely worse than before, and we count this as a case where the cataract surgery has led to vision loss. In some cases, it will be due to other eye problems progressing, but nonetheless, if a person's gone for cataract surgery expecting their vision to improve, but the vision in fact gets worse, then this needs to be monitored and reported. In the annual National Cataract Audit Reports published online, we also give data on how many people suffered severe vision loss. That is, those for whom letters need to be 4 times larger than before surgery in order for them to be read. On our website, we display the percentage of cases where the surgeon or the hospital have successfully avoided vision loss. This is the record for one surgeon. You can see that for all the cataract surgery in the national audit across the UK, vision loss was avoided in 99% of cases. And the surgeon in this example here has avoided vision loss in 98.6% of cases out of their total of 218 cataract operations, for which they have a record of the vision before and after surgery. This is slightly lower than the national average, but still comfortably within expected limits. Some surgeons will operate on a higher proportion of patients whose eyes may have diseases as well as cataract, which put them at greater risk of vision loss. To ensure the audit treats all surgeons equally, we use a statistical process called risk adjustment to ensure that surgeons who operate on the easiest cataracts in otherwise healthy eyes don't get a falsely positive view of their performance, and those that take on the most challenging cases are not misrepresented in a negative sense. It should also be pointed out that, as with any average, half the surgeons will have rates slightly better and half slightly worse. But the role of the nod here is to ensure that surgeons and hospitals can see their own results, and anyone whose results fall significantly below this national average value can have this flagged up and reasons for the situation investigated so that patients are protected as much as possible. No surgery is risk-free, but the fact that your hospital is participating in this national audit means they are actively monitoring their results, therefore able to take action if there are any signs that results are slipping. The audit results are publicly available on our website so that patients can be assured that we as a profession are doing what we can to be transparent in our efforts to assure the quality of the care that we offer.